Hello, this is Dr. Rhonda Waddell. I am coming to you from St. Leo University at the College of Education and Social Services, and I am talking to you about a research approach called Photovoice today. I'm representing also my colleagues Courtney Wiest, Rob Lucio, and Kaya Mukherjee. The title of our presentation, The Integration of Photovoice Across the Curriculum, Creating Student Engagement Through Social Justice. So what is Photovoice? Photovoice is a community-based participatory research approach. It's qualitative. It offers communication through the use of photography, discussion, writing, and outreach for participants and community members to investigate their experience and collaborate for change. It really offers a voice for those that are often underheard and underrepresented. So why use Photovoice? Participants' photographs can illuminate factors that influence access to health care, quality of care in life, social injustices involving oppression and discrimination, daily living perspectives and worldview, and can contribute to decision-making in respectful ways. Photovoice also offers a safe and a creative way for students and often minimalized members of society a comfortable platform for self-expression and advocacy to take place during research. So, what are some of the benefits of doing this? Many different benefits abound from the implementation of Photovoice research methodology, such as listed here are a dozen of them. Gives participants a voice in healthcare, community, and in research projects and settings. It raises awareness of resources or lack of resources and problems. It awakens appreciation for different points of view. It supports recovery and healing. It supports efforts to find purpose and meaning in life after a major life disruption. We see this in trauma cases. We see this in environmental disasters and in even pandemics like we're experiencing now. It empowers people, patients, and families and communities through advocacy. It creates powerful data for clinical care, research, education, and decision-making. It fosters patient, family, and community dialogue. It increases civic engagement between the researchers and the participants and key informants in communities. It strengthens writing and communication skills. It develops teamwork skills. It has a wide impact for low cost, and it establishes partnerships for change. We at St. Leo University used a number of research projects. We had 14 representatives come and do a Photovoice event where we had a gallery with all of our research with posters and photographs and narratives, and it involved our administrators, our faculty, our community partners, and our students, all in a dialogue about different issues that are important to the community and individuals. I'm going to mention a few of those here today. What does Photovoice accomplish? Photovoice plants seeds for future efforts towards change. That's the most important thing, is that Photovoice helps us to unite individuals, families, communities, service providers, and key informants to address important identified issues as shared endeavors to work together. Photovoice is an innovative approach of value to organizations, participants, providers, policymakers, researchers, and communities. But Photovoice is most importantly a catalyst for change and a way to open communication in often addressing sensitive issues that people face every day. One such Photovoice project involved using Photovoice to engage social work students in critical thinking. The keystone activity was a Photovoice project with 9 of St. Leo University social work students, all 18 years and older, an online student program, to understand student perceptions around the benefits of the veteran stand-down volunteer experience from their perspectives. And a veteran stand-down is an event where we highlight homeless veterans and try to connect them to resources and services to help them. So what questions were there? What motivated the students to volunteer for the Veteran Stand Down event was a question. How has volunteering at the Veteran Stand Down event enhanced their social work skills? How has volunteering at the Veteran Stand Down event developed connection to the social work and student community? And how has this event influenced perceptions of veterans? Again, photographs and narratives were used, themes were sought, and the themes that were identified in this case were connection to veterans, social work skills, connection to other volunteers, and motivation and volunteering towards being involved for this as meaning. As a result of attending the Veteran Stand Down, the students' photos and explanations of the photos identified the varied ways in which they engaged in the arena of social work practice, specifically with the military population. The students indicated that they learned about many different aspects of veterans' needs in connection with veterans and peers in the MSW program. The students also discussed the powerful connection to veterans, peers, and pride of military culture that was displayed during the event. A second Photovoice research project represented here was one that it also involved social work students, both bachelor's level students and master's level students, on ground and online in study. And they attended the LEAD Day, which stands for Legislative Advocacy and Education Day in Washington, D.C., where they were asked to take photographs which answered advocacy and social justice questions. And the students were to learn to apply advocacy skills to needed resources and services that they had wanted to approach. They were asked certain questions. What motivated them to be involved in the LEAD event? How had the volunteer experience affected their social work advocacy skill? How had participating in LEAD Day developed connections to the social work community? How did it influence their perceptions of advocacy? What highlights ideas of advocacy did they learn? And how does advocacy function as passive or active resistance within the context of social justice today? They again used photos and narratives and interviews, and they identified several different themes that included motivation to volunteering, their enhanced social work skills, their connection to community and advocacy, and social justice. And as a result, the students' photos and explanations of the photos identified ways in which they engaged in the arena of social justice, indicated that they learned many different aspects of advocacy in ways that they could help the voiceless have a voice, and discuss how their perceptions changed and identified ways that they felt like they could be active participants in the process of creating social change. A third and important project involved using Photovoice to understand diversity as it relates to social justice in the K through 12 context. This was conducted in a graduate course in education called Diversity and Leadership, and this is where Photovoice methodology was used to understand diverse students and the forces that shape their access to equitable and quality education at the K through 12 level in school. Students were asked to take photographs to answer framing questions related to the study of diversity at their school, and then relate their understanding of diversity to the social justice issues of equitable and quality education. They were using photos, they were using images and narratives to explain their positions and thoughts. The results of this research project was shared by the student researchers and shown through the photographs, which represent their experience in learning about social justice in their schools. The students in the K through 12 attended our Photovoice event. Just to name a few of the issues that identified through this project was exploring how poverty affects equitable access and quality of education, addressing behavior and working with diverse students to help themselves, and opportunities that increase the achievement of impoverished students, just to name a few. A fourth and final project that we wanted to highlight was a photo elicitation class project that was conducted by a group of students in the BSW level. And the students wanted to take photographs that would involve diabetic patients and what their lives felt like and their perceptions about living with diabetes. So the participants were the diabetic patients, and they were asked to take photographs to represent how diabetes appears in their lives. How does diabetes affect their diet? How does it affect their finances? And how does it affect their family? And the findings improved that there were emotional, behavioral, and significant impacts that involved support or lack of support that could be problematic or help one be successful in living with diabetes. The goal is to help persons living with diabetes enjoy the life that they have. Photovoice helps simplify the problematic situation. And finally, diabetes has a massive impact in society. With efforts to understand the environment from a holistic approach, the disease could be combated from a medical perspective as well as a social work perspective. They pointed out there was a need for more study to look at deeper into the lives of people living with diabetes. Finally, here are my references that have some very good information about how to use Photovoice. It also includes my contact information for my email, rhonda.waddell@stleo.edu. And I welcome you to ask any questions and to get in touch with me if you have an interest in having Photovoice be involved in your curriculum, classroom, or in a community project. Thank you so much for your time and enjoy the conference.